Most people think their knees are wearing out because of age, genetics, or some unavoidable damage that time has carved into their joints. They're told that stiffness, pain, grinding, and weakness are simply the price of getting older. But that story is incomplete, and believing it quietly robs you of hope, movement, and confidence. The truth is far more empowering. Your knees are not failing because they are old. They are struggling because one fundamental thing has been ignored for years, sometimes decades, and once you correct it, everything begins to change. Your body is not a collection of isolated parts. It is an integrated system that follows rules. When those rules are respected, the body adapts, heals, and strengthens. When they are ignored, the weakest link starts screaming first. For many people, that weak link becomes the knees, but the knees are really the root of the problem. They are messengers. They are telling you that the forces moving through your body are no longer aligned the way they should be. Think about what your knees do. They are not designed to create power. They are designed to transfer it. They sit between the hips and the feet, acting like intelligent hinges that depend on proper alignment above and below. When the hips are weak or inactive, and when the feet no longer provide stable support, the knees are forced to absorb stress they were never meant to handle. Over time, that stress turns into inflammation, pain, and the feeling that your joints have aged decades faster than the rest of you. The one thing that changes everything is restoring proper movement and strength in the system that supports the knees, especially the hips. Modern life shuts the hips down. Long hours of sitting shorten muscles, weaken stabilizers, and disconnect you from natural movement patterns. When the hips stop doing their job, the knees try to compensate, and compensation is always expensive. It costs energy. It costs comfort. Eventually, it costs confidence in your own body. When you begin to fix this, something remarkable happens. You don't just reduce pain. You regain trust. You start to move without hesitation. You go upstairs without bracing yourself. You stand up without planning it in advance. These are small victories, but they are deeply psychological. They remind you that your body is not betraying you. It's responding logically to how it's being used. There is a dangerous belief that pain means damage, and that damage means rest forever. But the body thrives on intelligent stress. When you give it the right kind of challenge and the right alignment, it responds by rebuilding. Muscles wake up. Tendons become more resilient. Joints receive nourishment through movement, not avoidance. The fear that movement will make things worse often does more harm than movement itself. Fixing this one thing requires awareness. You start noticing how you stand, how you walk, how you rise from a chair. Are your hips engaged? Or are your knees doing all the work? Are your feet connected to the ground? Or are they collapsing inward, sending twisting forces straight up into the joint? These details matter more than fancy exercises or expensive treatments. They are the foundation. When you strengthen the muscles that control hip stability and teach them to work together again, pressure is redistributed. The knees are no longer the dumping ground for every imbalance. They are allowed to return to their true role. Pain often fades not because the knees were fixed directly, but because they were finally supported properly. This process also changes how you see aging. You realize that many of the limitations you accepted were not inevitable. They were adaptations to habits that can be changed. That realization is powerful. It shifts you from passive acceptance to active responsibility. And responsibility is not a burden, it's freedom. It means your future is influenced by what you do today, not just by what has already happened. There is patience required here. Years of poor movement patterns do not disappear overnight, but the body listens quickly when it finally receives clear instructions. Small, consistent improvements compound. A little more stability today means less irritation tomorrow. Less irritation allows more movement. More movement builds strength. Strength restores confidence. Confidence encourages activity. The cycle reverses itself. You may notice that as your knees feel younger, other things improve too. Your posture changes. Your balance sharpens. Your lower back feels less strained. This is not coincidence. When you fix a central flaw in the system, benefits ripple outward. The body rewards coherence. Perhaps the most important change is mental. Chronic knee pain shrinks your world. You plan your life around what you can't do. When that pain recedes, your world expands again. You stop negotiating with stairs. You stop scanning rooms for places to sit. You reclaim spontaneity, and that has a profound effect on how alive you feel. This is not about chasing youth in a desperate way. It's about restoring function that was lost through neglect, not age. Your knees don't need to be babied. They need to be respected by fixing the mechanics that govern them. When you do that, you're not just healing joints. You're correcting a conversation between your brain and your body that has been distorted for too long. The body is honest. It responds to what you repeatedly ask of it. If you ask it to sit, it adapts to sitting. If you ask it to move well, it adapts to movement. The choice is not abstract. It shows up in every step you take. And when you finally address that one missing piece, the knees often stop feeling like fragile relics and start feeling like reliable partners again, capable of carrying you forward with strength, stability, and a quiet sense of confidence that had been missing. For years, most people are taught, directly or indirectly, that knee pain is simply the cost of getting older. The narrative is repeated so often that it becomes unquestioned truth. You reach a certain age, your joints start to ache, and that's just how life works. But this explanation is comforting in a dangerous way, because it removes responsibility and replaces it with resignation. It suggests that nothing meaningful can be done, that decline is automatic and irreversible. Yet, when you look closely at how the body actually works, this story starts to fall apart. The knees are blamed because they are where the pain appears, not because they are where the problem begins. Pain is loud, but it is rarely precise. It announces that something is wrong without explaining why. The knee sits in the middle of a complex chain of movement, and it depends heavily on what happens above and below it. When that chain functions properly, the knee operates smoothly, almost invisibly. When it doesn't, the knee becomes the point of failure, not because it is weak, but because it is forced to handle forces it was never designed to manage alone. Aging by itself does not suddenly destroy healthy joints. What actually accumulates over time are habits. Years of sitting, limited movement, poor posture, and repetitive stress quietly reshape how the body distributes load. Muscles that are meant to stabilize and generate power gradually shut down from disuse. Others tighten and dominate. The body adapts to whatever it is repeatedly asked to do, even if that adaptation is inefficient or harmful in the long term. Eventually, the imbalance becomes so familiar that it feels normal until pain appears. The knee is especially vulnerable because it is primarily a hinge joint. It is built for stability and controlled motion, not for twisting, collapsing inward, or absorbing excessive shock. When the hips lose strength or mobility, they fail to guide movement properly. When the feet lose their ability to provide a stable base, alignment collapses upward. The knee ends up caught between these failures, forced to compensate with movements it cannot tolerate indefinitely. The result is inflammation, irritation, and the sensation that something is wearing out. This is why people with very different lifestyles and ages often report remarkably similar knee problems. It's not time alone that connects them, but patterns. The body follows physics, not birthdays. Load has to go somewhere. If the muscles designed to manage it are not doing their job, the stress is redirected into passive structures like joints and connective tissue. Over time, those structures protest. The protest is interpreted as aging, when in reality it is accumulated mismanagement. Another misconception is that pain automatically means damage. This belief creates fear, and fear leads to avoidance. Avoidance weakens the system further, increasing instability and making pain more likely. It becomes a self-reinforcing loop. The knee hurts, so movement decreases. Muscles weaken. The knee becomes even more stressed during everyday tasks. Pain increases. At no point does age have to be the primary driver of this process. When you reframe knee pain as a signal rather than a sentence, your entire approach changes. Instead of asking how old your knees are, you start asking how they are being used. You begin to notice how you stand up from a chair, how you climb stairs, how you walk when you are tired. You realize that the knee is often working overtime, trying to stabilize motion that should be controlled elsewhere. This awareness alone can be transformative because it replaces helplessness with curiosity. Many people are surprised to learn that direct knee-focused treatments often fail because they address the symptom, not the cause. You can ice, brace, or rest the knee endlessly, but if the underlying movement pattern remains unchanged, the stress returns the moment normal activity resumes. This reinforces the illusion that the knee is fragile or permanently damaged when it is actually trapped in a poorly organized system. Understanding that knee pain is rarely about age alone is not about denying wear or pretending the body is indestructible. It is about recognizing that decline is not purely chronological, it is behavioral. The body is constantly remodeling itself based on how it is used. If it adapts in a direction that creates strain, pain is the logical outcome. If it adapts toward balance and strength, resilience increases regardless of the number on the calendar. This perspective is empowering because it restores agency. It suggests that improvement is not dependent on luck or genetics alone, but on addressing the real drivers of stress within the body. The knees stop being viewed as worn-out parts and start being understood as indicators of a larger pattern. Once that pattern is questioned, the idea that pain is inevitable begins to lose its grip. And a different possibility opens up, one where discomfort is not an identity but a message, waiting to be interpreted, where the body is not breaking down randomly but responding consistently to the demands placed upon it, and where change becomes possible the moment you stop blaming time and start examining the way movement has been organized day after day, year after year, shaping outcomes that felt unavoidable only because their true cause was never clearly seen. Once you understand that knee pain is rarely caused by age alone, the next step is realizing that the knees themselves are rarely the real problem. They are victims of a system that has stopped functioning properly, and the solution lies in restoring the strength, mobility, and coordination of the structures that support them. Among these, the hips play the most critical role. The hips are the powerhouse of the lower body, responsible for generating and distributing force during virtually every movement. When they're weak, stiff, or inactive, the knees are forced to take on responsibilities they were never designed to handle, and over time, that stress manifests as pain, inflammation, and a sense that the joints are failing. Restoring hip function is not a gimmick or a quick fix. It is the central principle that allows the knees to finally perform the way they were intended. The first step in fixing the support system is awareness. Most people have been living in patterns of compensatory movement for years, even decades. They do not realize that every time they bend, walk, or climb stairs, the hips may be disengaged, leaving the knees to absorb the stress. To correct this, you must learn to notice how your body is moving. Are your glutes activating as you step? Or are your quads doing all the work? Are your hips rotating naturally? Or are they locked, forcing the knees to twist unnaturally? This awareness is the foundation, because no amount of strength or exercise will help if you do not first identify where the breakdown occurs. Once awareness is established, strengthening becomes the next focus. The hips are made up of powerful muscles, the gluteus maximus, medius, minimus, and supporting stabilizers that collectively control movement and maintain alignment. Weakness in these muscles allows the pelvis to tilt, the knees to collapse inward, and the lower back to compensate. Targeted exercises that restore strength and coordination can immediately reduce the load on the knees. The simple but precise movements, performed consistently, activate the right muscles and teach the body how to distribute force correctly again. Squats, hip bridges, lateral band walks, and single leg exercises, when executed with proper form, are far more effective than endless knee curls or isolated treatments because they address the true source of imbalance. Equally important is restoring mobility. Stiff hips restrict the natural range of motion, forcing other joints, particularly the knees, to make up for the lost movement. Tight hip flexors, hamstrings, and surrounding connective tissue are common culprits that shift undue stress downward. Stretching, controlled dynamic movement, and mobility drills reintroduce freedom of motion, allowing the hips to absorb impact and rotate correctly. When the hips regain their natural mobility, the knees are no longer trapped in positions that grind or strain cartilage and ligaments. Suddenly, walking, squatting, or even climbing stairs feels less effortful and less painful because the system is working as it was designed. Another critical aspect of fixing the support system is coordination. It is not enough to have strong and mobile hips. The muscles must also fire in the correct sequence during movement. Many people have the strength but lack the neuromuscular control to use it effectively. This is why functional exercises, which mimic real-life movements, are essential. Lunges, step-ups, rotational movements, and controlled single-leg balances teach the nervous system to engage the hips first, transferring forces through the legs efficiently and sparing the knees from unnecessary strain. Over time, this rewiring creates a movement pattern that feels natural and effortless where the knees are properly supported by the surrounding structures rather than overburdened. Restoring alignment is another component of the support system. When the hips, knees, and feet are misaligned, the forces of walking, running, or jumping are distributed unevenly, creating points of high stress. Corrective exercises combined with attention to posture and foot mechanics gradually realign the system. A pelvis that tilts, arches that collapse, or feet that pronate excessively all alter the pathway of force through the knees. By addressing these upstream factors, pressure is redistributed evenly and the knee can function without compensating for structural misalignments elsewhere in the body. It is also worth emphasizing that restoring the support system is not about quick fixes or superficial solutions. Knee pain often appears suddenly, but the underlying dysfunction has been accumulating for years. Consistency is the key. Daily attention to hip activation, mobility, and coordination retrains the body to operate efficiently. Progress may be gradual, but it compounds rapidly. Each step taken with proper alignment, each movement performed with conscious activation, reinforces the system and reduces strain on the knees. Eventually, what was once painful or difficult becomes effortless, and the knees no longer feel fragile. Perhaps the most profound change when fixing the support system is psychological. People often fear movement because of pain, imagining that every step could worsen the condition. When the hips are engaged and the system is restored, movement becomes reassuring rather than threatening. Confidence grows as the knees are no longer forced to carry the burden alone. This mental shift reinforces physical improvements, creating a positive feedback loop where movement feels safe, strength is trusted, and the body becomes resilient again. Finally, restoring the support system emphasizes that the body functions as a cohesive unit rather than a collection of isolated parts. Knee health is inseparable from hip strength, mobility, coordination, and alignment. Treating the knees directly without addressing the upstream causes is like patching a roof while ignoring a leaking foundation. True improvement comes from correcting the underlying mechanics, teaching the body to distribute forces appropriately, and restoring natural movement patterns. When the system functions as it should, the knees are no longer stressed, pain diminishes, and the sense of fragility that once seemed permanent begins to dissolve, replaced by strength, stability, and renewed confidence in your own body. As the support system of the body is restored and the knees are finally able to function without being overburdened, the benefits extend far beyond physical comfort. Regaining proper movement and strength in the hips, alignment in the legs, and coordination throughout the lower body fundamentally changes the way a person experiences life. Chronic pain and stiffness are not just physical obstacles, they shape behavior, perception, and confidence. When those limitations begin to lift, the effect is as much psychological as it is physiological. Walking, climbing stairs, bending, or squatting no longer produces hesitation or anxiety. Every step taken without fear reinforces the understanding that the body is reliable, strong, and capable of movement that may have seemed impossible only a short time ago. The first and most obvious change is in confidence. Pain teaches caution, and caution often turns into avoidance. When knees ache, people unconsciously limit their activity, opting for the path of least resistance to avoid discomfort. Stairs, uneven ground, or long walks suddenly seem threatening. Even small daily activities like rising from a chair or getting into a car are approached with calculated care. This caution is a form of mental fatigue. It consumes energy and reinforces the notion that the body is fragile and failing. As the support system is corrected and the knees regain their functional capacity, that caution begins to dissipate. Movement becomes natural again. Simple acts no longer require planning or preparation, and the subconscious tension that once accompanied every step fades. Confidence is rebuilt step by step, literally, and it spills into other areas of life because the body is no longer sending constant signals of limitation and fear. Beyond confidence, regaining proper knee function restores freedom. Chronic pain constrains lifestyle choices. People decline invitations for hikes, avoid certain types of exercise, or stop participating in activities they once enjoyed because of the risk of discomfort. When the knees are supported, these limitations evaporate. Freedom is not just about moving without pain. It is about reclaiming the ability to live according to your own desires rather than the dictates of fear. It is the difference between living reactively, avoiding strain at all costs, and living proactively, engaging fully with the world. This freedom is liberating because it reconnects people with experiences they may have written off as impossible. Physical improvements also reinforce mental resilience. When movement feels strong and controlled, it affects perception of capability in general. The body is intimately connected with the mind. A person who walks with stability and ease experiences a subtle but profound psychological shift. They feel more in control of their environment, more confident in decision-making, and more resilient when facing challenges. Pain, on the other hand, reinforces helplessness. When the knees are no longer a constant reminder of vulnerability, the mind begins to trust the body again, and that trust becomes a foundation for approaching life with energy and assertiveness rather than caution and doubt. Restoring movement also enhances awareness and connection with the body. Many people live with chronic pain without ever really noticing how their posture, gait, and alignment have shifted. Pain dulls perception and normalizes dysfunction. Once the support system is rebuilt and the knees feel stable and strong, awareness of movement returns. People notice how their hips rotate, how their weight is distributed through the feet, and how their knees track during each step. This awareness allows for continuous refinement of movement pattern, which strengthens the body further and prevents future injury. Awareness becomes a form of empowerment because it replaces passive adaptation to dysfunction with active control over function. Another key aspect of regaining knee function is the ripple effect on other parts of the body. The lower back, hips, ankles, and even upper body often compensate for knee weakness. Pain and instability create a chain reaction that affects posture, balance, and gait. Once the knees are supported and properly aligned within the system, those compensations are no longer necessary. The lower back may feel lighter, balance improves, and movement feels more coordinated. This holistic improvement reinforces the sense of physical freedom and confidence, creating a virtuous cycle where strength, mobility, and awareness feed each other. Mental liberation is equally important. Chronic knee pain can shrink one's world, making everyday tasks feel like challenges that must be navigated carefully. When those tasks become effortless, the perception of limitation diminishes. People stop measuring what they can do by what causes pain. They stop structuring their lives around avoidance and begin to explore opportunities that were previously dismissed. This psychological shift is subtle but transformative, affecting not just movement, but the approach to challenges, relationships, and personal goals. A person who trusts their body is more likely to trust their judgment and take initiative in other areas of life. Rebuilding knee function also strengthens discipline and consistency. Corrective exercises, mobility drills, and strength training require regular attention and focus. As people see the results of their commitment, they gain a sense of accomplishment and control. The improvements are not instantaneous, but the compounding effects of daily effort demonstrate a direct correlation between action and outcome. This reinforces confidence in one's ability to influence results, further strengthening mental resilience and self-efficacy. Finally, the transformation extends to identity. Chronic pain often leads people to identify themselves as fragile, injured, or limited. When knee function is restored, that identity begins to shift. People start to see themselves as capable, strong, and resilient. The sense of empowerment derived from moving without fear creates a new narrative about the body, aging, and potential. This new perspective is liberating because it reframes the relationship with the body not as a collection of vulnerable parts, but as an integrated, adaptive system capable of recovery and growth. Confidence, freedom, awareness, resilience, and identity are all renewed as the support system is restored and the knees regain their proper function. The physical improvements are the gateway, but the psychological transformation is the true prize. Movement is no longer something to be feared or avoided. It becomes a source of empowerment, a tangible demonstration that the body can heal, adapt, and perform at a level that may have seemed impossible just months before. With proper support, alignment, and strength, the knees stop being a limitation and start being a symbol of regained control, vitality, and renewed confidence in both the body and mind. When you step back and see the full picture, it becomes clear that knee pain is rarely a simple matter of age or inevitable decline. It is the result of a system that has lost balance, where weak hips, poor alignment, and compensatory patterns have forced the knees to bear burdens they were never meant to carry. By addressing the root cause, strengthening, mobilizing, and coordinating the supporting structures, you not only relieve pain, but restore the natural function of your body. As the knees regain their stability, your confidence returns, your movement becomes effortless, and your freedom expands. The process transforms not only your physical ability, but also your mindset, empowering you to trust your body, reclaim activities you once avoided, and engage with life fully. Healing the system above and below the knees allows them to perform at their best, unlocking strength, resilience, and a renewed sense of vitality that resonates throughout your entire being. Your knees can feel decades younger, and the life you live can feel decades freer.